Hello, Dr. David McFadden here from the Dental Implant Center in Dallas, Texas. Today's topic is why all-on-4 prostheses cannot be cleaned. I just searched on YouTube for cleaning of all-on-4 dental prostheses and literally hundreds of results came up. And I'm here today to not only tell you that what they're telling you on these videos is not true, I'm going to show you why an all-on-4 prosthesis cannot be cleaned in the mouth. Basically, it's a design problem. So the way I'll start this presentation is by telling you that the first two cases I'm going to show you are actually good all-on-4 outcomes. They're still failures, but they're two of the better all-on-4 outcomes I've ever seen. Both these patients came to see me afterwards because they were having one problem or another. So the first lady you'll see here, it looks pretty good in her mouth. You can see maybe some signs of problematic cleaning here. So what we do is we take these prostheses out. And this is what you see. This is food debris. It's called material alba. It's a mixture of plaque and food debris, and it's super gross. And sometimes you can even identify the food that was last eaten. It's so disgusting. So patients that get all-on-4, the problem is, and I'll go into this in more detail at the end, but all-on-4 prostheses are designed like a saddle. Like a saddle on a horse. If this is the prosthesis, it fits down like this on top of the gums and around the implants. And we've known since the dawn of dentistry that you can't have concave surfaces in the mouth. They're uncleansable. But for 15 years and millions of patients, this is the way it's been done with all-on-4. So this is what you find afterwards. That's her upper arch. This is her lower arch. Again, food debris and material alba. And in the mouth, that results in inflammation, also food debris. And on the lower, you can actually see the same. And the worst part is bad breath, halitosis. Whenever you have dead and decaying food in your mouth, you're going to have bad breath. So my heart goes out to all the all-on-4 patients that have received this prosthesis because it is uncleansable. More about that in a minute. Patient number 2 just came in last week actually. Same basic look when you retract the tissues. Here again on the lower you can see maybe perhaps the beginning of some problem. He's had this prosthesis for 3 years. I show this picture because the all-on-4 centers, they've monetized the problem they created. So what they tell patients now is that you'll have to come in twice a year and have your prosthesis removed so that we can clean it. Most places are charging $500 for the upper and $500 for the lower. So it's $1,000 twice a year to clean the problem they created. Add insult to injury. This patient that just saw me last week wanted me to take his prosthesis out and clean it, which I was happy to do. So now that they're removing the prostheses twice a year, they've become so lazy and so greedy that they're not filling the screw holes up with the composite resin at the end. What we typically use to fill these screw holes is Teflon tape to start with, and then a plug, on top of that a plug of composite resin, so that it's smooth, and more importantly, so that it keeps food out. So now these poor patients, because they don't want to take the time to put the plug in after they replace the prosthesis, and it takes even longer to take the plug out when they come back in 6 months, so they've just done away with the plug altogether. So now these patients all have food, not just collecting on the underside of the prosthesis, but now it's collecting in the screw holes where the implant prosthesis is being held to the implant. And I'll show you the lowers the same. The Teflon even came out of 3 of these 4, so he had food packing down all the way to the top of the screw. That can become a problem if it calcifies. We can't always get the screw out. But again, just so incredibly wrong for the patients who trusted you and paid you tens of thousands of dollars for these prostheses. And this is the aftercare. So I'll move. So this gentleman, we took his prosthesis out, and my assistant had already cleaned most of the food off of the upper, but this is what you can expect to see in and around the implants and on all the concave surfaces of both prostheses. And here, again, food debris underneath the prosthesis that's been trapped for months. And I'll show you the final lower. So not only is there food debris here, there's hyperplastic angry tissue because they can't be cleaned. So I've showed this demonstration in other videos. And like I said earlier, we've known forever that you can't have concave surfaces in the mouth. These are all concave surfaces where the prosthesis meets the tissue, or anytime it goes around the cylinder or the implant, it creates an uncleansable situation. And this little piece of floss, so people would say, well, you can water pick or you can floss. But the problem is every concave area and every area around the exposed cylinder or abutment now becomes unreachable. It's like a safe haven for bacteria and food debris and plaque. So anything under the floss now is uncleansable. Think about the saddle. Tell me where you're going to get floss to go into that space right here. How are you going to get floss up there? It'll bottom out on the two edges, and the water pick's going to shoot through like this. It's never going to get up into the most recessed concave area, which again is a safe harbor for food and bacteria. So here's a great all-on-4. Now this patient didn't have any hygiene. He wasn't doing anything to clean these. But this is how many people with all-on-4 present to our office. Completely covered with food, bacteria, material alba. So we clean everything up and get it back to its high shine, the way it was delivered. So let me ask you this. We take the prosthesis out, we clean it, we put the same prosthesis back in. How long do you think it stays clean? Minutes, hours, days, weeks, months. Remember, you're not going to go back to get it taken out to be cleaned again for 6 months. I will tell you that it's clean for one meal. So you finish your dental appointment, you're going to go to lunch after that, or you're going to go to dinner after that. That's how long it stays clean. And they're going to do this to you twice a year for $1,000 each time. So you can have a clean prosthesis for a few hours. So again, what's the definition of insanity? Repeating the same act and hoping for a different outcome. So in my practice, everything we make is convex. Instead of it being concave and saddle shaped, it's convex. We're making prostheses that don't have a safe harbor for food and bacteria. So a patient comes in to see me, if he or she doesn't have zirconia, which this was not, we can change the shape of the prosthesis. And even with zirconia, there's some techniques where we can change the shape of the prosthesis. So what do? I'm not going to put this prosthesis back in, charge him money to take it out and clean it, only for it to stay clean for a few hours. So what I'm going to do is a addition-subtraction process. We're going to turn concave into convex, meaning we're going to take away the extensions that cause the edge of the saddle, and we're going to add in the middle. So now he's going home with a convex prosthesis. He has at least a fighting chance to keep it clean. This is not a small task because now we have to retrain the tissues to accept this convex arrangement. So this may take an hour, and it may take a little bit of local anesthesia because we're now compressing the tissues with the bottom of our convex shape. But bottom line is, like I said earlier, all-on-4 prostheses, no matter what you hear, no matter what you see on YouTube, they cannot be cleaned. Concave is bad, convex is good. Thank you for listening.